Welcome back, Rohrich Knows Podcast, helping you become a better and more informed and safer you. Let's talk about redo facelifts. We talk a lot about facial rejuvenation, but let's talk about the secondary or the revision facelift. And is it truly different than a primary facelift? Find out in this episode. So, of course, a primary facelift is much like a primary rhinoplasty. You know, the dissection areas are clean, the anatomy is usually quite normal. And in a secondary, it can be pretty messed up. It can be scar tissue. There can be lots of different areas, especially in today's world of fillers and neuromodulators, and also with different energy devices. You can really have an incredibly scarred face and neck area. So let's talk about how you can transform that. And we'll talk a little bit about how you can revise and redo a facelift to give you a very good natural results, and the role that fat plays in that area. So, you know, the history of facelifts is kind of doing the same thing over and over again and expecting to get different results, but doing it the same way. And that's why you end up with, some significant patient issues like this famous Hollywood actor, or just, the overdone, overstretched look, and really that deformity that really makes people look abnormal, because we should be in the face protection, not witness protection program in plastic surgery. And it really makes me very sad to see, famous actors and actresses that actually have this type of appearance. But we have to understand how we age, and we age by volume loss, by losing fat in our face. These are 4 key concepts. We lose fat in our face. Fat is a structural support of the face. And then you lose fat volume, that alters facial shape, and that facial fat loss is predictable. And that's why when we discovered the use of facial fat compartments and how we could restore them, it was a game changer. Because if you look at post-op patients, 8 years post-op, with no fat on the left and fat on the right, you can see that these patients look significantly better, even though they just had fat and no fat, and they had the same type of facelift 8 years later. So fullness is a sign of youth. Facial fat aging and loss is a sign of aging. And let's just go through what I think are some observations in facelifts. If you do a facelift in somebody under 50, they look better. If they're more attractive, the better the result. If they have a fuller neck initially, they're going to have a higher relapse rate. If you have a full face, you have more longevity if you do your facelift. And if you open the neck, your chance of getting a neck contour problem is less. And interestingly, males have a similar revision rate to females, which is surprising to me. And that everybody looks better with skin resurfacing, and also that includes laser abrasion and TCA results, and if they use long-term skin care. And same with minimally invasive brow lifts. But the most important thing of all is that all patients that have central selective facial fat augmentation look better, longer, and look more natural. That's the key. And the role of the deep malar fat augmentation is so critical, especially in males and in revision facelifts. And I think that's the key here. And I'm going to tell you about how I look at secondary facelifts. But my whole facelift philosophy is that you want to have a natural look, don't overdo it, less is more. And I tend to operate on people that are nice and the ones that I like, and that I want to give them a great jawline and neck contour. And of course, I give them my cell number. All of them are done under general by the same group of anesthesiologists. All of them get the same preoperative medication. I keep them normotensive in the operating room and postoperatively. That's why I keep them for 2 days. And we do the same efficiency, the same staff, the same sequencing. And we actually they're seen by myself every day, twice a day. Dressing change is done in 2 days, shower and ACE wrap. And for 2 weeks, I see them every 3-4 days. They must stay in Dallas 10-12 days, longer for lasers. And they all get lymphatic therapy within a couple of weeks, and post-op visits, regularly scheduled post-op visits. So the key is, when do you need to do a secondary surgery? Well, obviously, if they have neck bands or laxity after 12 months, you should consider consider that. Many times Botox will help soften that. But you must have a revision policy for how to manage that. But what about a patient that requires or wants to do a revision facelift? You know, when I do a facelift, usually it lasts between 8 and 12 years. So I'm now seeing many of my patients I've done 8, 10, 12 years ago that want a secondary facelift. So I can tell you, you know, what I do, and I know exactly what I did before, so I can easily manage them. But what about patients that have had multiple different procedures done elsewhere? They present with facial distortion, fat loss, scar deformities, overdone look, and unnatural appearance. Well, these are patients that really require more challenging look because they are inherently beautiful, but they have the stigmata of an overdone facelift. And I think the key thing is 5 different things that you must consider. Resect the scar, release it, release the ligaments, refill it with central facial fat, reshape and restore, as you saw in this beautiful patient that we restored and refilled her central face and shaped it and contoured it and reshaped and restored her jawline and gave her a beautiful jawline and shaped it, because all of this is done meticulously to undo some of the things that were done a while ago. So you do a central facial deep layer facelift, you do central facial fat augmentation, and so all of this is done based upon preoperative planning, analysis, and visualizing what the endpoint is. And the key is you have to be safe, versatile, and you have to be able to deliver consistent long-term results. And you have to customize it to the problem. So here's a lady that is a few months post-op, and you can see she's had a previous facelift, and she's now after her secondary facelift, and we also did fat augmentation to her hands. She looks absolutely amazing. And, you know, she's a couple of months post-op, and you can see, you know, we did central facial filling, we did deep layer facelift shaping. You can see she looks remarkably youthful but natural. And you can see her jawline is also beautiful. I reshaped her jawline and shaped it and gave her a nice, beautiful shape and look. And then, and all of this is done with a deep layer facelift and central facial fat augmentation based upon her preoperative facial analysis. So revision facelifts are completely different. And then I also did facial augmentation of her hands with autologous fat. You can see here she is after that. You can see that she's got much improved shape of her hands. You don't see the veins and the bridging of the tendons anymore, and it looks really quite dramatic. And I think that's really what you want. You want to have the nose, the face match, and also her hands. And I think she's, as you can see, she's all smiles, and she's a beautiful woman. And so revision facelift surgery is different, but it can be very gratifying, and you can see she's just very robust about that as well. And here she is before and after her 3-month post-op with shaping of her central facial filling and shaping of her jawline and reshaping of it. She gives you a beautiful, natural-looking appearance, which is what you want. And I think that's really the big thing. So in conclusion, revision facelift is completely different than a primary facelift, but the goal is the same. You want to restore a natural look. You want to use the role of a deep layer or a SMAS procedure to reshape the outer layer of the face, and centrally facial fat grafting, release the distorted tissues and ligaments, and reshape the with deep layer techniques and technology. And using those principles and staying safe, you can get very uniform and consistent outcomes in revision facelift surgery. So give me your comments, give me your thoughts on facial rejuvenation, revision facelift surgery, and above all, find a board-certified plastic surgeon or a facial plastic surgeon that's an expert in facial aging and facial rejuvenation if you're going to get a revision or a secondary facelift. Until next time, stay safe and stay informed.